Good day. Today we will continue our discussion of Kirkpatrick's evaluation method. We'll continue discussion with level 3, evaluating behavior. So we'll have four major topics in this particular presentation. We'll talk about the Kirkpatrick's four levels again, a review so that you will be more familiar with it. Then we discuss what is level 3 all about. Then we'll continue with discussing guidelines for evaluating behavior, and then discussion of the instruments that you can use in evaluating using the Kirkpatrick's model. So just a review, as we have discussed several times already, Kirkpatrick's level conducts evaluation into time frame. The first two training evaluation will happen during the actual training program, and that will be the level 2 and the level 1, and the other two levels will happen in the workplace or several months after training. And just to review, for level 1, our central question is to what degree participants react favorably to the learning event. Learning 2, our central question is to what degree participants acquire the intended knowledge, skills, attitude based on their participation in the learning event. Level 3, to what degree participants apply what they learned during the training when they are back on the job. And level 4, to what degree targeted outcomes occur as a result of the learning events and subsequent reinforcement. In this particular discussion, we will focus our attention on the evaluation of behavior, and what exactly is the evaluation of behavior all about. So if you are evaluating at level 3, what will you evaluate? So we go back to this framework, and you probably remember that in each of this framework or stages backwards, we'll have specific level examples. And for today, or in this presentation specifically, we'll answer this particular question: were they able to transfer skills to the workplace? As I said earlier, talk about training. Level 1 will be reaction, level 2 will be learning, and several months after, we go to the workplace and evaluate several months later. Because of course, not all behavior that they learn can be applied immediately when they return. There are other central requirements for that. And the central questions we can ask ourselves when we go to level 3 are the following. What happens when trainees leave the classroom and return to their jobs? How much transfer of knowledge, skills, and attitudes occurred? And what change in job behavior occurred because people attended a training program? So together we'll try to see how we can answer these three central questions. Let's just review for a moment, go back to Miller's clinical skill competence performance model. And when we talk about behavior, we talk about the top two levels, showing how and doing. So level 1 and level 2, you talk about or measure or you evaluate cognition, but in level 3, if we follow Miller's model, we will be basically evaluating the two top behavior dimensions, shows how and does or doing. But we all know that behavior change just don't happen, because behavior change can only be seen when there is an opportunity to do so. Some behavior encouraged in the classroom is not appropriate for all participants. For example, you try to make them behave this way in relation to, let's say, universal precautions. When they go back to their health facility, they don't have the necessary equipment or tools to perform universal precautions. Or it is also important for us to remember that occurrence is impossible to predict. When will it happen exactly? It may occur anytime after the first opportunity or never at all. Sometimes staff will be transferred after their training and they end up not being able to perform or to practice what they actually learned in their training program. It is also worth noting that behavior change may be influenced by or two major motivational factors: the intrinsic and the extrinsic factors. Intrinsic, generated by the individual, this will involve satisfaction, pride, achievement, happiness, while extrinsic, from the outside, that will be help and encouragement, the rewards available or being provided by the workplace. Let's go to them in details. So, as you see in this particular matrix or crosstab, you see how both positive and negative and extrinsic and extrinsic motivation influence each other in relation to performance in the workplace. Behavior change will not just happen. So when you ask a question, for example, what change in job behavior occurred because people attended a training program, that question may be complicated because we know that behavior change will not happen unless there is the opportunity to do so, as I mentioned earlier. Or reward or intrinsic motivations being utilized to change or to influence behavior. Well, there available both intrinsic and extrinsic motivation. And we, as also discussed, it is impossible to predict when a change in behavior will occur. So all of that will have implications. For the first question, behavior change will not happen unless there is the opportunity to do so. The implication will be to evaluation and trainings, a selection of trainees. Are you selecting trainees that will have the opportunity to practice when they go back? In relation to reward and intrinsic motivation, do you provide teaching learning strategies that would encourage adult learners specifically or especially to learn more? There may not be enough incentive for them to learn further. It's not of their interest. They were not interested in the training, but nevertheless were sent by the superiors because there's no one else to be sent. And last one, it is impossible to predict, and the implication, of course, will be in the decision making on when to conduct your level 3 evaluation. Will it be 1 week after they return, 2 weeks after, several months after? We don't know. So sometimes you may have to look at literature and help make decisions along that direction. Now, there are conditions for behavior change. According to Gilbert in 1998, there are about 6 major conditions that would influence behavior change. Let's go to them one by one. The first will be environmental data. So we ask, does the individual know what behavior is expected of him or her when he goes back to work, for example? Does the individual know how well he is performing? Is feedback available? Are there mentors? Do they document the performance of behavior? Are individuals given guidance about their performance monitoring? Meaning you want trainees to practice the behavior that you learn, but is the environment conducive for that kind of transfer of learning? The other condition will be instrumentation. Does the people have the right tools for performance? Meaning you train them, for example, for computer use of Excel or use of statistical software, but when they go back to their respective offices, they don't have the right computer system. They don't have the software. So what they learn will be put to waste because there's nothing there to help them perform the learned competencies. And of course, it's the same with the second statement, or the tools, materials designed to match the human factors of performance. So when they went back, you want to develop creativity, but is the school environment or the hospital environment providing that kind of creativity, or it's too stiff, or like, no, you cannot change that, no, you cannot innovate. So at the end of the day, your MHPL graduate will just say, what for? I cannot change anything anyway. I want to change the testing, but they don't want to change. I want to change the curriculum, but they want to stick to the old one. The other issue will be, of course, external incentives. Now I want to do things. Now that I learned something new, that I am now an expert in something, will there be some incentive for the new job or the new role that I will perform? Or it will be the same. So you added more tasks, but you didn't add any incentive for me. So if there are no monetary incentives, are there non-monetary incentives, for example? Like, say, opportunity to present papers to international and local conferences with appropriate support, and will there be promotion available to you person after the training? So I'm the most qualified here. I have attended several trainings, but since I came back 2 3 years ago, I have been in the same position, while I see others who have no training go up just because they're probably much more well connected than you are. And of course, knowledge of the individual. How can you transfer if the knowledge that you learned in the training is not enough to even perform the procedure? Probably you wanted them to perform BLS, and you ask them to watch a lot of videos. At the end of the day, you don't really have simulators. You don't really have the real feel of being in an emergency, and you end up knowledgeable but probably not skilled. The training may not be well designed to match the requirement of performance available. As I said, you may be asked to perform certain procedures, to use high-tech equipment. At the end of the day, you go back to your hospital, your x-ray facility is still the same x-ray film that you dip in the chemical, and then you develop it while you learn in your training already a computer or digitized version of radiologic imaging. The other issue would be capacity of the individual. So when, for example, when you visit for the level 3, did you schedule it at the time when they are able to perform at their best? Maybe when you arrive, when you evaluated the trainee in their workplace, they're depressed, or they have some problems, or that a lot of things are not working very well, including instruments, and therefore you may not be able to see them in their best condition, and you may end up saying that the trainees, when they return to their workplaces, are not able to perform. Or do they have the physical ability to perform the job? So maybe when they went back, they cannot perform because suddenly they realize, or the things they need to do would require more than the regular physical requirement that they used to do. For example, about emergency procedures, and you end up carrying people, or then you have proper positioning, but you end up with really being alone in the emergency room, and you cannot carry the patient properly, and you end up violating most of the proper protocol or in handling or carrying your patients. And the last one will be, of course, individual motives. For example, in level 3, were you able to assess motivation? Why are they not performing well? People willing to work for incentives, or are people recruited to match the realities of the job? I have been discussing this already for the last several slides, emphasizing that people that should be recruited to the training should really be the same people who should perform the job. I have experienced or have heard several reports or complaints from participants that after they go back to their job, they basically are transferred to another job. And the people who attended the training, therefore, are not able to perform the job that they are trained to. And those who want to, and there are also people who attend the training or don't like the training, but nevertheless were sent because, as I said earlier, no other people to be sent to the training. So you end up being the only person available in the hallway and asked by your dean or your boss to attend a specific training, which basically from the very beginning you don't really like. So this brings us to some of the guidelines for evaluating behavior when doing level 3. But of course, you can also do this for other evaluation models. First of the guideline will be use a control group if practical, meaning you can talk about people, comparing people that did not attend the training and those who attended the training, and compare their performance. Do you see any significant difference in the way they perform, so that you say, oh, this is worthwhile, I can see significant change, so maybe next time I really send more people to this training. Second guideline will be to allow time for behavior change to take place. As I said earlier, no evaluation should be attempted until trainees have had an opportunity to use the new behavior. So before you even go to the workplace for assessment, you should ask the people there in the field where the trainees given opportunity to perform the new behavior. And if the local workplace would tell you, no, not yet, then probably it's not time for you to go there. I mean, it's just a waste of your time and money and resources evaluating a behavior that probably you will not be able to see anyway. So for your training, for example, let's say for the plans that you prepared, or the in training of physicians for family medicine, or training, for example, of call it nurses in emergency room, or even like asking people to watch video prior to their surgery. You try to answer the question, what behavior do I want them to demonstrate? When do I expect that behavior to be observed? Now for the video presentation or pre-surgery presentation on what to do, how to prepare, and on the peri-surgical things that they should observe, you expect behavior to be observed immediately after the surgery. You don't want it to be observed like 1 month after surgery, right? You talk about physicians being trained for family medicine. Probably you may not be able to observe some of the competencies today, tomorrow, maybe next week, next month, or even some of them will only be exhibited when they are already in the workplace. And then what assumption would you have for them to be able to perform the learned behavior? Of course, for example, for patients, they will only be able to perform the behavior if they actually underwent the surgery, so that you will see if indeed they were able to practice the precautions or the other behavior that they should perform to protect them from developing additional complications, right? And for family medicine, to ensure, for example, that they were able to practice, that they were able to start their family medicine practice, or otherwise, after residency, and they end up, working as a call center agent for a nurse, like for example, or started working in a private clinic or in another health insurance company, then probably what they learned in family medicine, they will not be able to perform. Guideline number 3 will be to evaluate before and after the program if practical, meaning you can go evaluate before they enter the training so that you can compare the performance at the end. So you do both evaluation pre-training and post-training. The post will be in the workplace, of course. It's important because you may want to really see if there are significant improvement in the performance of certain competencies, especially competencies that were learned in the training program. Now, the fourth guidelines will be on who will you survey or interview? Who do you want to collect data from? Say, will you be the immediate supervisor? Will it be the trainee or the trainee subordinates? And the trainees as subordinates, like they may have staff below them. So to be able to identify who will be the most appropriate persons, you need to answer 4 questions. Who is best qualified? Who is most reliable? Who is most available? And are there any reasons why one or more of the possible candidates should not be used? So let's go to each question. So first, who is best qualified? Subordinates will see the behavior of the trainees on a regular basis. Others, like the boss, with regular contact with the trainee. Supervisors may be the least qualified unless he or she spent a great deal of time with the trainee, because sometimes there are supervisors who handle so many people and they really don't see them. So they just see this trainee once in a while, and then if you ask them to the respondents for the behavior change, you may end up with collecting data that was only seen in a particular moment and may not be the total performance or total behavior of the trainee in the workplace. Who is the most reliable? Major concern, of course, will be bias in favor of or against the trainee by respondents, which may distort the results. So, as much as possible to reduce the bias and to check the bias, use of multiple resources is encouraged. Then the other issue, the who is most available. So it depends on situation or how data will be collected. If interviews are to be conducted, then availability is critical, but if questionnaire is to be used, availability may not be important because you can actually send them, hand carry them, or you ask them to answer it online using Google Form or other opportunities to answer the questions. Then the last will be, are there any reasons why one or more of the possible candidates should not be used? Yes. For example, asking subordinates for information on the behavior of their supervisor may not sit well with the supervisor. So let's say the trainee was the supervisor and the respondent will be the subordinate, and they might not give you the correct answer or the most appropriate answer because they're afraid that it may come back to them in form of whatever, probably negative behavior from the people that they are rating. So you can actually add to your table that I showed earlier: behavior, time expected to be observed, factors that would ensure performance of learned behavior, and then the last column will be source of information and why. As much as possible, get 100% response or sampling. You can also repeat evaluation of behavior at appropriate time. It could be third month, at 6 months, at 12 months. It is important to repeat the behavior at an appropriate time so that you can see consistency in the performance of the behavior, and also be able to identify some major issues or factors that would have influenced the performance or non-performance of a certain behavior or learned behavior. And of course, you need to also consider cost versus benefits. Now, some of the instruments that you can use, you are very familiar with. Let's start with the first one, which is the survey. So you can actually do a survey. What specific behavior you taught and encouraged to use when you left the program? How eager were you? So this can talk about motivation and talk about availability of instruments and factors also that help them identify factors or help you identify factors that may have influenced the performance or affected the performance or non-performance of a certain behavior. You can also go online evaluation form like this one. It could be in the form of a PDF file or Word file, or they can use Google Form, for example, for them to just check. We do this a lot in some of our trainings. We just ask our participants to answer post-training questions via Google Forms, especially if we can ask the sending agency to participate and they can enforce the post-training evaluation. And if you have time and opportunity, you can actually go visit and conduct interview, and this can be a guideline that you can use. So again, you don't just interview, you need to develop a interview guide or focus group discussion guide. So you can go interview and FGD guidelines in case you need to interview people individually or in groups. So let me end with this particular quote from Manis Abraham: our actions change our minds can change our behavior, and our behavior can change the outcomes. And that's exactly what the logic is all about in relation to Kirkpatrick's model. So thank you. So this is the end of level 3 discussion, evaluating behavior.